Due to a grant to fund an AED, we have been able to save lives. AEDs are an important tool for first responders. They play a vital role in the chain of survival in reducing the effects of cardiac arrest. The AED provides a continuity of care by recording the patient's cardiac events from the time we apply the AED until we arrive at the emergency room. We are grateful for our partnership with the Foundation that allows us to continue our mission to provide the greatest level of care to Glastonbury and its residents.
Hi, I'm Laura Menta. I'm a chair of the Glastonbury Greater Together Community Fund. This is our 5-year anniversary. And the grant that we gave to Glastonbury EMS is just one example of the wonderful grants that we have given to support our community. Over the past 5 years, we have given over 50 grants totaling more than $138,000 to nonprofits that better life for the residents of our town. This is our story.
The Hartford Foundation established a community fund for each and every one of our 29 communities. You all, as residents and stakeholders of the communities that you live, work, and play in, will have the authority and the decision-making capacity around where these funds go.
The foundation recognized every community is different. Their support allows us to address unique solutions and needs that matter in our own backyard.
Well, the whole initiative is unique in a way. It's an example of participatory philanthropy, and there aren't many instances of that around. It's an opportunity for citizens to elect, to decide collectively how they want to invest money in the community.
Participatory grant writing is unique, I think, for individual organizations that apply for grants. It takes the application to a different level, and the town's residents really know what they need.
The partnership between the foundation and the local communities is more than just funding. It's a belief in the power of local voices and in local solutions.
The community fund matters because we're often giving money to nonprofits that may not have huge operating budgets like other nonprofits, larger organizations. Sometimes we do, and that's fine, but oftentimes these are groups that are asking for, $1,000, $5,000. And those small amounts of money really make such a big difference in the mission that they're trying to accomplish.
What surprised me is the needs of this town we tend to think of a very wealthy town, but it has a lot of needs of a community that's out there that doesn't, have huge household incomes.
Many people think of Glastonbury as a very wealthy town, and yet we have hard needs as well as soft needs here. Needs like domestic violence, food insecurity, mental health concerns, they all exist in a town like Glastonbury. And then we have these other needs that I will call quintessential Glastonbury, like things that are uniquely Glastonbury and need to be supported.
This organization can help a lot of organizations in town. The most impactful grant that we have made to the town's food pantry, and we got behind it with a $15,000 grant, and it's flourished to this day, and it continues to grow.
With the Glastonbury Greater Together Community Fund support, For All Ages was able to reach into the community and reach older adults that we wouldn't have otherwise reached. And we were able to talk with residents at adult living communities. Thank you to the members of the Glastonbury Greater Together Community Fund Committee for enabling us to make a difference in the lives of Glastonbury residents.
I'm very hopeful about the future. I know that the Hartford Foundation for Public Giving believes in this program. They have committed to giving funds so that we, in the continued future, can provide meaningful amounts of grants as investments in our community.
The foundation's foresight to establish both the endowment and current use funds means we can meet needs today while building a legacy for the future.
I'm very grateful to the Hartford Foundation for Public Giving. I'm grateful that they set up the community fund, the Glastonbury Greater Community Fund, and the whole Greater Together program in all of the different towns. It gives all of us the chance to have a voice in our community and make an impact, which, is not something that everybody gets to do.
Being on the board is a really pleasant surprise. I joined the board January of 24, And I have learned a lot, and one of the things that I'm most amazed about is the level of commitment and the deep history of Glastonbury that the members possess.
This group has been great, and I feel like I know, so many more people now just from being on this committee that I otherwise probably wouldn't have met in my day-to-day life.
Just finding new people who care as much about the community as I do. That's the joy.
I would say it is one where we have quite a diverse team of folks, different ages, different ethnicities. We have students from the Glastonbury High School. We all work for a living. We're all trying to make money. We're trying to save money for retirement. But I think the reward in everyone's life is how you lift up other people. And I'd say that's what the community fund's all about. I would welcome more people, young students, older people, people of different generations to come and join this wonderful foundation. So I would say that's it in passing. Why sit on the sofa when you can get engaged and help people? That's the reward.
Amplify aims to help everyone. We serve as the Regional Behavioral Health Action Organization for the North Central region, which is 37 towns in Greater Hartford and Talon County. At Amplify, our mission is to advance healthy communities, and one of the ways that we do that is by amplifying best practices to ensure that the best prevention, treatment, and recovery supports are available to everyone. For us to be able to promote an evidence-based practice like that at such a young age is key. We're very grateful of the support from the Glastonbury Community Fund. The support that they've given us is going to allow us to provide a program that we know is going to help children at a young age and probably save lives.